Hi, it's Bill Schaefer. A lot of people on Dental Town have asked me to get a video together of an internal sinus lift using PRF and the BSB Crestal lift kit. Finally managed to get a spare nurse to take an iPhone video. So I'm just going to run through it. The whole thing from start to finish takes 15 minutes, so it's not a huge long one. The first x-ray you see is of this patient's upper right first molar tooth that's had it. So we took it out, let everything heal, and the second x-ray that you see here is what we have to work with. We know from our cone beam CT that we've got somewhere between 3 and 4 millimeters of bone. So here's the video starting. Don't worry about the lighting, it gets better in a moment when the nurse hits the right button on the phone. So all I've done is I've made a simple crestal incision. That's all it is. This is a small flap surgery. I've just run a burr along the crest from one tooth to the other. No relieving incisions. This is not the size of flap that I would use if I was doing a lateral sinus graft. This is just opening up the gum so you can see the crest. That's all it is. Now, because you're going to see me needing both my hands later on when I do the actual sinus lift, I'm going to make my life easy by giving myself an extra pair of hands. I'm going to do some retraction stitches just to hold these sides of the gum apart. So take your stitch and do a mattress suture, a horizontal mattress suture. Take a big bite of the cheek. People think a big bite is going to hurt more than a little tiny bite. It only hurts if the whole thing rips out, and that will happen if you take a small bite. So take a big bite and suture that flap to the cheek so that every time you pull the lip open to have a look inside the mouth, you reflect the flap as well. That's easy to do on the buccal flap, but what about on the palatal flap? Because you haven't got anything to stitch to there. Well, as some of you have seen me do before, this is what I do. I do another mattress suture, but I leave the tail of the stitch, the bit of the stitch without the needle on, I leave the tail long, and then I'm going to clip that with the needle holder and just have the weight of the needle holder hanging over the far side of the mouth, and that's going to do all the work of reflecting the flap for me. As soon as I cut this, you'll see the flap just open up a fraction. So now I'm ready to start making the hole for my implant. And I'm going to start just by getting myself in the middle of the gap. For this kind of thing, I wouldn't normally use a drilling guide, but of course you can if you want to. All I'm looking to do is to make a hole in the middle of this space. And if you've got a tooth in front and behind, it's fairly easy to eyeball a gap. Obviously, if you're a beginner, use a drilling guide. Once I've made my little mark, my little notch, ding, dent, whatever you want to call it in the crest, I then use a big round burr going fast, and all I do is I create a nice funnel shape, a countersink, because that's going to make everything else much easier with the drilling. My drill isn't going to skip or skid around. To go into the sinus, I use the Blue Sky Bio Atraumatic Hammerless Crestal Sinus Lift Kit. It's a big old title, but it makes life easy. You have drills that are safe cutting at the end, and you have sleeves or drill stops that stop you from going too deep. I tend to skip stages on this, so I just take 2 of the end cutting drills, the second from smallest and the biggest, and I put a sleeve on that I know is going to be short. In this case, I've done the drilling with the 3mm sleeve. I check to see whether I'm through, and I'm not, just like I knew I wouldn't be from the CT scan. And now I'm going to put the 4mm drill sleeve on, so it's a shorter sleeve. I drill deeper in. And with this, with the widest drill, I just punch that in and I check to see whether I'm through. And here I can feel that I am just through into the sinus. So I've gone through the bone of the sinus floor, but I haven't gone through the membrane of the sinus floor. So now what I'm doing off camera is getting my platelet-rich fibrin ready. I've drawn the blood up from the patient right at the beginning. As soon as they walk through the door, I say hello to them, sit them down, I draw some blood from their arm. I spin that in the centrifuge. Settings are all set down by Joseph Shukran, who developed this technique. And then I let it stand for 10 minutes. And now I'm just drawing off the platelet-rich fibrin. And when you first take it off, they look like slugs, yellow slugs. And I just cut those slugs into either 2 or 3 pieces, depending on how big the slug is. And I'm going to use those slugs as my sinus graft. I'm going to use it to atraumatically lift the sinus membrane. So I've taken the last drill stop, the 4mm drill stop, off my drill, and I've put it on the packer that comes with the BSB Crestal lift kit. And that stops me from pushing the packer in too deeply and damaging the membrane. So in a moment, I'm going to come towards the patient's mouth with some non-toothed tweezers and some platelet-rich fibrin and a packer with the 4mm stopper on it. And all I do is I just start working that piece of platelet-rich fibrin into the hole that I've just made. Just takes a minute or so just to get all that stuff ready. So there's the 4mm drill stop on the packer, so I can't pack too quickly. And this is a piece of that PRF. It looks like yellow jelly. And you just work it into the hole. Just squash it in, push it up. I don't need to be gentle because I can't go too deeply because that stopper on the packer stops me from going too deeply. Because this PRF is like jelly, it's very gentle on the sinus membrane. And just work it in. As you push it in, it'll want to squidge back out, so you just work it in, work it in, work it in. And you put in as much as you want to. You can, put as many of these little bits of slug, as I call them, as you want to. So all you do is just keep working this material in. That's going to atraumatically lift the sinus membrane away from the inside of the sinus. After I've packed 2, 3 or 4 of these little pieces of slug in, then I'll change the drill stop, the stopper on that plugger, for one that's a bit shorter. In other words, a 5mm stop instead of this 4mm, so that the plugger goes in a little bit deeper, starts to lift that membrane just a little bit more. These little pieces of jelly, these little PRF slugs, have lots of water in them, lots of water from the blood. It's all like a supercharged blood clot. And so as you squidge it in, some of that water squidges out. You see my assistant with the suction there, or it squidges into the sinus. All of it's very atraumatic. There's nothing damaging. There's no particles to get lost up into the sinus. It's very slow, very gentle way of lifting the sinus. So here you get a slightly closer look. And you can see I'm not gentle with the packing. Just shove it in, push it in, work it in. I can't do any damage because the stopper on that plugger stops me from going in too deeply. So push it in, work it in, do what you need to. Now, at this stage, what I'm going to do is I'm going to finish my osteotomy. So this is the final drill before I put my implant in. I don't use irrigation. I have it going very slowly. And let's face it, I only need to go in 4mm because we know that there's between 3 and 4mm of bone in this case. So I don't need to go in very deep. You don't need irrigation if you're drilling slowly. Once you've done that, just do a final bit of packing. Here's a bit of PRF slug. Again, I just think of it as supercharged blood clot. It's got all the growth factors you need. It's going to help the whole area heal. anything that you put in underneath the sinus membrane is going to help create bone. But if you've got lots of growth factors, then that's really going to help create bone. I've got a little compressed piece of PRF that I'm about to put in now. In the PRF box, you have a little piston that allows you to compress, make a little disc of PRF, and that's what I'm pushing in now. Even more concentrated disc of goodness. So this is the only graft that I'm using in this case, with between 3 and 4 millimeters of bone. And once I've pushed that in, I'm ready to put my implant in. I'm going to give the whole area a wash with some metronidazole. We like doing this just because it makes me feel good. There's no real science or evidence behind it. We do this for all our implants. And now I'm taking an Ankylos CX implant. This is 4.5 millimeters wide and 6.6 millimeters long. So it's the shortest Ankylos implant they make. We know we've got between 3 and 4 millimeters of bone. So this is going to be about half in bone and half in the sinus. Put it in, fairly controlled. And I always do the last bit of insertion by hand, so you can feel how tight the bone is, feel how tight the implant is in it. So here we go, just with a ratchet. It's not a torque wrench this, it's just a ratchet. So it just allows me to get it to the right depth, and I can feel how good the torque is on it. So there it is, that's the carrier sticking out. The implant's probably about 1 millimeter below the level of the bone, which is what I like for these implants. I unscrew the carrier. And I'm just going to stick a cover screw on because we're going to bury this implant. Let's face it, it is only in 3 and a bit millimeters of bone. So I'm not going to put a big healing cap or sulcus former on there that the tongue can wiggle and loosen this whole thing in. Let's give it a chance to work. I'm cutting that retraction stitch. The nurse pulls on the needle holders, and then I've just cut the mattress stitch to the buckle flap, and if I can find the end I'll just pull that out and it'll go up the assistant sucker. And now all I'm going to do is just stitch this closed. You can use whatever stitch you like. You can put some PRF in there before you close if you want. For me, I'm just going to put 3 little dissolvable stitches. This is Vicryl Rapide 4.0. Nothing special. Just 3 interrupted stitches. And that's just going to close it off. So in a moment, at the end of this suturing, you'll see the final x-ray. We always take an x-ray on the day of placement. I don't know anybody that doesn't. And you'll see that the implant's in a nice position. And you may be able to see the platelet-rich fibrin graft lying above it. I would leave this case for 4 months now before going back and uncovering the implant, attaching a sulcus former to it, and then 1 month after that we'd take impressions for the definitive crown. Hopefully that showed you a little bit of how to use PRF and the Blue Sky Bio kit. I have to say, and I'm not paid to say this, but the Blue Sky Bio Crestal Lift kit has just completely changed how I do things. I assume I'm not going to damage the membrane with it, just because you don't if you use it the way that I'm using it. You can lift the membrane easily. You can just punch through very quickly and very reliably through the bone into the sinus without damaging the membrane. Anyway guys, I hope you enjoyed the video. This is what I do on many days each week. I don't tend to do lateral grafts much anymore because these are so much simpler, easier, quicker, cheaper, and because I'm not putting lots of particulate in the sinus, I don't have to worry about infection. Alright, hope you enjoy it. Thank you very much.